Good afternoon, Mendocino County, and welcome to our COVID-19 Friday update. Today we have with us CEO Carmel Angelo, Health Officer Dr. Noemi Doohan, and our Department Operations Center Manager Becky Emery. So with that, I'm going to turn it over to CEO Angelo for a county update.
Good afternoon, and thank you, Sarah. This is our Friday afternoon COVID-19 update. And we're pleased that everyone is with us today. And we have Dr. Doohan, who will be doing our update today. And as Sarah said, we also have our Department Operations Center Manager, Becky Emery, who will be here as well to discuss any of our operations or any of our numbers. But before I turn it over to Dr. Doohan, there's a few things I would like to remind the public about. And one is the Mask Up Mendo campaign. And this is a grassroots campaign that was started with the Chambers of Commerce in our 3 cities and also with North Coast Opportunities. And we have contracted with both groups to do a Mask Up Mendo campaign, which is outreach and education with the public. And the chambers are doing the general public, and North Coast Opportunities is doing targeted outreach to youth and to the Latinx population. And so I wanted to bring this up again this week because we are very fortunate to have these grassroots organizations actually step up and do this work. So on behalf of the county and the County Board of Supervisors, I would like to thank these groups for stepping up yet one more time. Additionally, last week we did talk about enforcement. We still have all of our enforcement efforts out in the communities, and I spoke with our Special Investigations Unit Chief, John Martyr, earlier today, and the SIU staff will be out in force again this weekend, trying to enforce our masking order and also working to educate people on what the public health orders are and how everybody could stay safe. Additionally, we do have a contract that was approved by the Board of Supervisors, and that contract is to assist us with isolation and quarantine. I wanted to speak to that because there have been some questions. This is a security agency that we have worked with in Health and Human Services in the past, and we are contracting with them because not everybody that has to isolate or go into quarantine is compliant. And there are many times that we have people who we put in quarantine in a hotel and we pay for their quarantine. We provide meals and we attempt to assist them to stay quarantined for a certain period of time, and they walk out. And they can be a danger to others. So in that regard, this is isolation and quarantine for non-compliant COVID positive people. And so I did want to speak to that since there were some questions during the week. I wanted to clarify what this security contract is for. And also I wanted to just clarify some misinformation that has been out in the public. This is misinformation that has been reported, and I believe that some of it did come from within Mendocino County. And we spoke in the board meeting and also last week about our outreach to outbreak business processes, and that we now have environmental health working on a business process with our other communicable disease staff because we are identifying so many outbreaks within our businesses. And so this afternoon, the environmental health team is actually at Walmart. And this is no secret. We've identified this and we've put it in the press that, excuse me, there has been an outbreak at Walmart. And so our staff are doing contact tracing and investigation of this outbreak. Some questions that came to me earlier today, though, had to do with the comparison of Walmart with some of our grocery stores and also with the Ukiah Co-op. And we know that over the last month or so, the Ukiah Co-op did close down for a couple days because they had some employees that were COVID positive. I would like to say that the Ukiah Co-op has been a gold star business as far as responding and keeping their employees and members of the public, their customers, safe. It was the good work of the manager, Lori Rosenberg, who worked with our health officer and decided that for the safety of her staff and the safety of her customers, that she would close and do deep cleaning and then reopen as soon as she could and as soon as the county had done contact tracing. That was really the best thing to do, and we're very appreciative that the co-op and public health worked so collaboratively. There was not a direct order for the co-op to close. It was, I would say, a mutual decision, and it was a good decision, and it showed exemplary leadership on the part of the general manager of the co-op. And now we have Walmart, which is a very large store, and we know we have identified 3 employees. It is early in this identification of the outbreak at Walmart. Again, I said that we have county staff there this afternoon. The question came up and the question was, is the health officer going to direct that Walmart close? There is no direction at this point in time by our health officer that Walmart should close. And I wanted to be real clear. All of these businesses are being treated fairly. We are doing as much as we can to assure that we have a process in place that the public understands and that treats all these businesses fairly. And so there is more to come on all of the existing outbreaks that we have right now, and that includes Walmart. I wanted to go ahead and speak to this because the questions came to me this morning, and I wanted to be certain that we were able to answer these questions this afternoon. Usually when 1 or 2 people come forward with questions, there's 20 people at least behind them that have those same questions. So at this point in time, I would like to turn it over to Dr. Duen and thank her for her work, and she will talk a little bit more about the business outbreaks and everything else that we're currently dealing with at this point in time. Thank you.
Thank you, CEO Carmel Angelo. So we are entering or in 7 months of living in emergency with this pandemic. And the nature of a pandemic is that increasingly we don't see the normal operations that we enjoy when we're not living in a pandemic. And right now, one of the biggest impacts that we're seeing in public health across the state of California is a failure of the state data system called CalReady. This data system is a system that we rely on in public health, in local public health jurisdictions. We rely on CalReady on a daily basis to give us data about communicable diseases. So what we've learned, I just got off a call with the state where the state health officers were asked to join an emergency call across the state where we were told that indeed there is a failure of CalReady at this time. Not only have we not been receiving our COVID results through CalReady, but as I just learned on this call, we've not been receiving other communicable diseases that come through CalReady. And that's because of the volume, the sheer volume of reporting of positive COVID cases essentially crashed the system. So this is going to be, as I understand it, the governor will be making a press conference later today or in the coming days about this. Also, what we learned on this call is it's not only that the CalReady system crashed, but also one of the major labs, which they did not name on the call, also had essentially a data crash where they weren't, this major lab was not reporting their results into CalReady. So this now explains the phenomenon that we saw in Mendocino County, where I stood before you here and I said, I'm looking at the data, thanks to the hard work of our communicable diseases team and our DOC, I'm looking at the data on a local level. I've called the state to say our data qualifies us to be on the watch list, unfortunately. And specifically, that data was exceeding 100 cases per 100,000 population in 14 days. So for our county with a population of 90,000, that would be 90 cases in 14 days. And the data that I was analyzing on a daily basis with our DOC exceeded 90 cases in 14 days. But when I took that to the state, they said, well, we don't see the same thing that you see. So it does appear that we may have been the very first, or at least one of the early counties that reported this problem to the state that shifted the attention onto where was this data mismatch happening. And now we're finding out It absolutely is not a Mendocino problem. This is a statewide problem, and this is why we're not on the watch list. Our data, thankfully, very early on, perhaps because we're rural and we go old school all the time, very early on, from the beginning, we said, not only are we going to rely on CalReady, the computerized state system for our data, we are going to ask our healthcare partners to call us and fax us when they have positives. And that's been going on from the very beginning of the pandemic. And thanks to the collaborative relationships which we have with our healthcare partners, we've been getting faxes and calls on our positive results. And that's why we know our local data. We know what it is. We're not relying on the state. But what we did become aware of was a mismatch. And to give you a sense of the magnitude of this mismatch, our most recently reported data as of this morning was that we have 363 cases in Mendocino County and 10 deaths. The state sees 260 cases and 1 death. So I'm going to repeat those numbers. We see 363 cases and 10 deaths. The state sees 260 and 1 death. So that's, they see 10% of our deaths, and they have a third less of our cases that they're seeing. And that's what we're hearing across the state of California, that there's a third of the cases that are not being recognized at the level of the state. And those counties, the local jurisdictions that have been monitoring their own data in collaboration with their hospitals and clinics are able to say, you know, what their data is locally. For this reason, I have not asked that our data on our website be taken down. There are other counties that have asked their website to not reflect their data because it may be inaccurate, because they've been relying on the state. But our data, we believe, I mean, I'm confident that it is accurate. So we're keeping our data up, but we are anticipating that there may be a surge in our numbers, as it may be that some of the labs did not report back. And if the labs don't report results back, then we are blind to that data. So we count on the lab reporting the results to the provider who ordered the test, and then that coming to us. Regarding surveillance testing, with OptumServe, we have a very, at this point, solid reporting system. It may be delayed. It does go through Quest. It may be delayed, but the reporting is solid because it comes through a system, an electronic email reporting system to the people who got the tests themselves. With the UCSF free surveillance testing program, which we're very grateful that we have for free surveillance testing from UCSF, but we have been having with University of California, San Francisco challenges with that data being received by our county and then being able to analyze that data and get it out to our partners who've been doing the surveillance testing on the front line. And what we've done, and Becky Emery's on the call and on our update today can speak to this more, but we've put special staff on this problem so that we can unravel the tangled data that we get from UCSF and get it out to the front lines in an organized fashion. And that's been a priority this week. So we mourn the 10 deaths that we have in Mendocino County of our people. And it's a significance that we're at 10. We also, our data for the number of patients in the hospital, of course, this is a dynamic number because people are discharged and admitted. But as of this morning, we had 14 cases in the hospital, about half of them at the Ukiah Hospital and half of them at the at the Coast Hospital in Fort Bragg. The patients that are in the Fort Bragg Hospital are primarily those that have been coming from Sherwood Oaks, where there has been an outbreak. And we're very grateful to the partnership that we have with Adventist Hospital, that they opened the hospital for isolation beds for the Sherwood Oak patients that were actually not sick enough to be hospitalized, but we needed them in an environment where that isolation could be maintained in strict fashion while we contain the outbreak at Sherwood Oaks. I'll speak more about that in a moment. So that was regarding data. Regarding the watch list, are we on the watch list? The answer is no. Our data qualifies us to be on the watch list, but as I said, the state does not see the data that we see. We now recognize that's a statewide problem, and because of that, we are not on the watch list. We could go on the watch list as soon as the data at our local level catches up to the state. And on the call that I was just on with the state, it sounded like that data catch up between the state and local levels might occur in the next week. in which case I would anticipate in the next week or two, we could end up on the watch list. At this time, the only thing that going on the watch list would change in terms of our reality here in Mendocino County with orders is would be regarding schools, but I'm going to tell you it will not change what is going on regarding schools. So those counties that are on the watch list already, their schools in their counties must go through a waiver process to have in-person learning. This is coming from the state. Those counties that are not on the watch list, according to the state, do not need to have their schools go through a waiver process to reopen. Therefore, in Mendocino County, we do not have to have our schools go through a waiver process to reopen. The state has also made clear that for counties that do go on the watch list in the future, those counties will still not have to close their schools, okay? So regardless of whether we go on the watch list or not, the situation with the schools is independent at this point for us in Mendocino County of our watch list status. As I've repeated before, I'll repeat it again, I did not close the schools and I will not close the schools. The school operations is ordered by the state, and the state finally now has guidance out and FAQs out, which you can find on the CDPH website, that guides what schools will or will not be allowed to do that open. Many of the schools in our county have decided that it would be too difficult to comply with the state orders, the restrictions from the state that oversee schools. And in fact, that's what we're seeing across the state of California, that it's small schools, charter schools, and schools with small populations that are able to open under the orders of the state that oversees schools. But in Mendocino County, the schools could decide to open at any time, as long as they comply with the orders from the state regarding school opening. There are two elements about the orders from the state that are imposed on the schools that are important to speak about. One is that there's a requirement regarding testing of, for example, teachers. So teachers are critical infrastructure workers, and in such, if they are teaching in the schools, they should have periodic surveillance testing. And at this time, what we offer in Mendocino County is the OptumServe resource, which is based in Ukiah. That will be a resource available to the schools that do open, that want to have their teachers have free surveillance testing on a regular basis. We do prioritize testing at OptumServe for our critical infrastructure workers that need to have periodic testing. For example, workers at skilled nursing facilities. In addition, however, the schools can choose to do their own testing, organize their own testing for their teachers, and we hope that that is something that will also be done by the schools that choose to open. The other element regarding schools that choose to open that is mandated by the state is that there be a point of contact at the schools, for example, a school nurse that would be the liaison with the county, and that individual, for example, a school nurse, would be in coordination with the county if an outbreak were to occur in that school, if there were to be any cases in that school that has opened. So in the coming weeks, I am going to be focusing my attention on these two elements for schools, the testing and the single point of contact and the liaison with the public health department, and clarifying how the public health department can support the schools in those endeavors, and also clarifying the protocols and processes when the public health department is involved. I also want to speak about the outbreaks, which CEO Carmel Angelo mentioned. We have 3 active outbreaks right now that we're following in the county public health department. The first one is Sherwood Oaks Nursing Home in Fort Bragg. The last count that I have was that there were 34 cases at Sherwood Oaks, and 25 of those being residents, 8 staff, and 1 spouse of a staff member. That's a dynamic number as well. I believe that is the most current data. Of those cases, there were 7 deaths. Those were all of individuals who were residents of Sherwood Oaks, and we mourned the deaths of those individuals. Those 7 deaths are included in our 10 total deaths for the county. Currently, I believe we have 7 hospitalized. Again, it's a dynamic number because some were discharged back to Sherwood Oaks and some are in the hospital. They've been hospitalized for isolation purposes primarily because the outbreak in Sherwood Oaks has not been sufficiently contained. We did have a visit from the state yesterday, which Kelsey Rivera, our DOC manager, co-manager, attended. And this was a great state response for us. We're very grateful that a state representative came and visited Sherwood Oaks to look with us and see what we might be able to do more to support Sherwood Oaks. Sherwood Oaks has responded in exemplary fashion, has cooperated, has had transparency, including daily press releases, has coordinated, done everything that should be done when there is an outbreak. And I say this because I, as the health officer, am not going to shut down any business or any facility that is collaborating, that is cooperating, that is transparent in their actions. The reason why I would shut down a business or a facility is if they were not collaborating, if they were not cooperating, and if they were not following the health office orders. That is not the case of Sherwood Oaks, which has followed every order and everything in compliance. So our role in public health is not to shut them down, it's to find solutions so that they can continue to operate. And the solutions have been to bring in an expert from the state, to collaborate, thank you, with Adventist Health, who took the isolation cases into their hospital in Fort Bragg. And these are the types of efforts that we put into place when there's an outbreak and there's cooperation and collaboration. This was the case with the Ukiah Co-op, a gold star response on their part. I never shut down the co-op. There was no need to. They're absolutely cooperative. With Walmart, we're seeing the same response, cooperative, collaborative. The management is taking this very seriously and responding. So there is no reason to shut that business down, to order it shut down by the health officer. We do have another outbreak that we're watching closely at Ukiah Post-Acute Skilled Nursing Facility. This is with employees, 3 employees. They're all in isolation. All of their close contacts are in quarantine. There are no cases amongst the residents. We've done outbreak testing there. There's no evidence of any outbreak among the residents. There is no reason for me to shut down that nursing home because they're absolutely cooperating and collaborating and doing everything and being transparent, including allowing us to speak about this outbreak publicly, which is a sign of cooperation. So to repeat, the health officer does not shut down businesses or facilities that are cooperating with the health officer orders. What we do is we support for that institution to do the right thing. And thankfully in our county, every business and every facility has done the right thing. And we're very grateful for that. My final point is about new orders. I'm not releasing any new orders this week. I'm not opening up any businesses further or closing any businesses further. We're holding our line where we are. There are going to be new orders coming out in the coming weeks regarding protocols for reporting. So this will be a data reporting protocol to help us manage our local data coming from our hospitals so that this mismatch that we're getting from the state is something that we can be prepared for. So these are protocol orders. They're not punitive. It's just saying, here's a way to report your data to us on a daily basis. The other reporting that I'm going to be working on will be on some type of guidance for the schools, for those schools that do open, so that with testing and having that single point of contact at that school, we can facilitate the communications for the schools for this specific areas of testing and points of contact. That would be anticipating a potential outbreak at a school. And then thirdly, we are working on protocol and outbreak protocol order for businesses. When businesses have an outbreak, facilitating the protocol for what would occur in that business. Coming next week, I am contemplating, and I will share this with you, what I am contemplating. I am contemplating limiting our gathering sizes, which are now only allowed for places of worship and for people that are having funerals or memorials, that currently these activities can only, and protests is the other one. These activities can only occur outside, and that's across the state of California, but that they have a limit of 100. And I am contemplating dropping that number to 50 next week if we continue to see the surge occurring now, which is quite concerning for our county. The other element that I will be addressing in orders next week is I have spoken about the health officer can only be stricter, not less strict than the state. And right now, the state for sports, for youth activities, has indicated that there cannot be youth activities like sports where there's contact. And in my orders right now, I have extracurricular activity units for children, where within these units of 12, children can have close contact, and that is not in alignment with the state at this time. These new orders from the state about youth sports came out earlier this week. So that will be another change I'm contemplating for next week, is regarding the extracurricular activity units for children, which again, those bubbles allow contact, close contact with the bubbles, and the state is saying that is not allowed. So thank you very much. That's my report for today, and I appreciate your time.
Thank you, Dr. Doohan. We're going to go to our media who's on the line. First up, we have Mike Adair with Willits Weekly. And Mike, you're muted.
I've unmuted myself. Can you hear me okay?
We sure can.
Okay, great. So I got two questions. First of all, can you tell me what's going on with testing at the Redwood Creek Care Home in Willits? Do we have any results of those tests, or what's the status?
Yes, thankfully, we have some good news to share. Becky Emery, I see you're muted, but can you unmute and speak to that?
Certainly. We have had testing that we have done at the Redwood Creek Care Home. Those test results have come back, and they have all come back negative.
Great.
Fantastic news, yes.
Yeah, that's good. Good news. Can you say how many tests were done there?
While Becky is looking that up, of course, there were the initial positives. And with our case investigation contact tracing, those individuals were in isolation, their contacts were in quarantine. So Becky is referring to those individuals, the outbreak testing that we did. So the big net that we threw out to see if we found any additional positives.
Okay. My second question is OptumServe, has to do with OptumServe. My understanding was that they had a contract with, we had a contract with California that was going to end early August, I think August 1st or sometime in early August. Do we know what's going to happen after that contract ends?
You're giving us such a great opportunity to share good news today. Thank you. We also have good news about OptumServe, which also Becky, I think, knows the exact date, but I know it was good news. It was certainly through August. When is our end date, Becky?
So our end date at this time for that contract is September 30th. And so the state is funding that contract, and we expect to continue those services in their current location throughout September as well, which we're very, very excited about. They've also increased the number of surveillance tests from 132 to 154.
And this is a free resource. The tests get sent to Quest Lab, and Quest Lab then processes the test at their lab in San Juan Capistrano, which is a national lab. They get samples from across the country, not just from California.
Okay, all right, thank you. Thank you very much.
Thank you, Mike. Next up, we have Sarah with KZYX. And Sarah, you're muted.
Can you hear me?
Yes.
Okay. My first question, I'd like to go back to CEO Carmel Angelo's information about the contract with the American Guard Services. I understand these are going to be armed guards with, guns and batons and pepper spray. And I'm wondering if you could go into some of the details about the oversight and the level of force that they are going to be empowered to use on people who do not comply with the quarantine orders.
This is CEO Angelo. Thank you for the question, Sarah. The contract is a public record. I will say that. It's possible that you've seen the contract. Any member of the public could get a copy of that contract. That contract is going to be monitored by the Special Investigations Unit. It is a contract of the Special Investigations Unit, and it is a contractor that they've been used before. I did speak with Chief Martyr about this contract, specifically about the issue that you bring up, Sarah, of use of force. It is in the statement of work that the contractor may use, I believe it says a gun, chemical use, and there's one other,
impact weapon.
Impact weapon, yes. So I did ask Chief Martyr about that, and the response from him, and again, Chief Martyr is the head of our enforcement unit. He's been around the county system for many years, and quite honestly, I don't ever remember a complaint about Chief Martyr using force in an inappropriate way. But given that the contractors, these security guards, will be alone either at a hotel or another location with non-compliant people who are COVID positive, the thinking is that they would need a way to protect themselves and to enforce the order. And so whether they would actually carry a weapon or not, that will be on an individual basis. I'm not a decision maker on that. That will be between Chief Martyr and the Special Investigations Unit, the contractor, and what the assignment is. So that is the information I can share with you. Yes, the contract does say that they can be armed, and I think that will be on an individual basis as to what they're doing and who they are working with as far as non-compliant COVID positive people. And again, that contract is a matter of public record, and anyone could access that contract.
Right, I have not found anything against American Guard Services, but in Australia, there were some problems with a guard service not following proper protocols and not being trained in infection control protocols. And I was concerned about that. I'm wondering if we can look forward to more regular updates from a public health officer. It's been 2 weeks since we had one from Dr. Dewin, and you're aware that the Board of Supervisors has also not been receiving updates from Dr. Dewin, and I'm wondering if she or Dr. Corin will be available soon to offer public updates.
Well, I'm on here today, and I was on here last week as well. Last week, I thought it was important to use the time to focus on enforcement because we had so many questions about that, but I was right in front of you here giving an update. And in fact, I'm updating on a daily basis through our DOC. And through our DOC, we have many representatives who are speaking, sharing information. So I do not believe that there's a lack of communication from the health officer. Dr. Corin is actually listening in on the call today, but he has not started in the role yet. So he would not be the person that would be speaking in the public eye. But I don't know if there's any more that you'd like to add to that, Becky or Carmel Angelo, but we speak as a team and communicate as a team.
This is Carmel. The only thing I would like to say is that last week, we did believe it was important to focus on enforcement. We hear multiple questions and concerns from members of the public around enforcement. So it was our goal to spend the full 90 minutes on enforcement. Dr. Dewin was with us if there were questions for her, but that was our focus. And you can see that on Fridays, we do try to have a particular focus for Media Day. And what we look at is those questions that come to us through the week or some event that happens during the week and wanting to explain that and work with the public on that on Friday. I trust that between Dr. Dewin and Dr. Corin, that we will have a health officer with us for all media events. Thank you.
Thank you, Sarah. Moving over to El Punta, Jackie Orozco.
Hi. La primera pregunta es, ¿cómo se está asegurando el condado que los negocios están reportando los casos positivos de COVID-19, si es que los tienen o no? Y si lo están reportando a sus empleados y al Departamento de Salud Pública del condado.
Okay, how is the county making sure that the businesses are reporting whether they have or not positive cases at their businesses to Mendocino Public Health and to their employees?
I want to be sure I understand the question. So I'm going to answer the question, and then if I didn't answer it, please ask again. We in the Public Health Department rely on labs and CalReady, as I talked about, the state, reporting all positive COVID cases to us in public health. So when the system is operating properly, the Public Health Department receives every positive case reported to us. We then report a positive case to the person who is positive. And we tell them, you need to tell your employer, you need to not go to work, you're in isolation, you need to stay home. And then we ask them, when we do our case investigation, where do you work? What your contacts might be. That's the case investigation contact tracing. So we ask the employee to tell their employer, and then as we're tracking the cases, if we see more than one showing up in a workplace, we then start monitoring what's going on in that workplace.
Okay. Lo que sucede es que cuando alguien se hace un test de laboratorio, esa información viene directamente al Departamento de Salud Pública. Nosotros nos ponemos en contacto con la persona que ha salido positiva al COVID-19 y le informamos que tiene que reportar esto a su empleador o a su supervisor. Y si hay más de un caso relacionado al mismo centro de trabajo, porque esa información llega primero a nosotros, ya nosotros tomamos acciones como ha sucedido en algunos otros casos. ¿Eso responde a tu pregunta?
Sí, básicamente sí es que tenían alguna manera de que los empleadores o las empresas o los negocios tuvieran conocimiento, o si hay algún protocolo en los que ellos tengan que informar a sus empleados, porque han habido muchos casos que no les han informado, y informar al público en general.
Ok, lo que sucede es que esa información viene a través de nosotros, o sea, porque nosotros somos los que nos enteramos primero, y muchas veces antes que los mismos empleadores o los mismos trabajadores, porque la información del laboratorio viene directamente a nosotros y a nosotros nos comunicamos con ellos.
Okay. Bueno,
another point, sorry, Jackie, I wanted to add another point to that. There are circumstances where the employees don't live in our county, in which case we don't know that there are positive cases working in that workplace. And in that situation, we do get information from the public, and we follow up every case or clue that we get from the public. So it might be on social media, there's an outbreak at this business. Then we start asking questions, well, who is it and what's their name? And then if we can find out more information, it's common that, oh, they live in Lake County. Then we would never have known that information. But then we might call Lake County, we might call Sonoma County. So anytime we get a clue that there might be an outbreak at a business, we always investigate it.
Okay. O sea, puede suceder el caso que la persona no trabaje dentro del condado. Puede estar trabajando en el condado de Sonoma o el condado de Lake. Entonces ya cambia un poco la situación. Pero si es aquí dentro de nuestra jurisdicción, nosotros siempre intervenimos y estamos atentos a qué cosas más podemos hacer para controlar un brote en algún centro de trabajo.
Okay. Y la segunda pregunta es, en Ukiah tenemos una comunidad de trabajadores agrícolas que vienen con una visa de trabajo a trabajar en el condado. ¿Han pensado en organizar algunos talleres informativos para darles información sobre COVID-19 y sobre cómo hacerse el examen? ¿Quién sería el responsable de informar a este sector de trabajadores que solo habla español?
Okay, we have here in Ukiah seasonal workers that only speak Spanish. Have you thought of ways to provide information besides the county websites, such as workshops, and provide surveillance testing in this population? Who is the responsible to implement all these measures here in Ukiah?
So may I ask our PIO, Sarah Duquette, to speak about the information, the efforts we've been using to work with our Latinx community?
This is Sarah. So I would say it's definitely a work in progress. The board gave direction at a few meetings ago, and the board also put together a task force to work with Mendocino Latin Alliance. And so that's moving forward. We're trying to do a couple of things. We're bringing on additional translation assistance. We're working on a strategy to incorporate more Spanish language. So more website, more social media, more PSAs, partnering with our cities to also do additional work. So I would say that we've been able to make some progress in the past couple of weeks, and we're looking to make more progress, hopefully over the next month or so, as we onboard more resources, both with contact tracing, public information, and translation. So we're improving every week, and so hopefully we'll have a more robust Spanish outreach within the next month or so. And also working on outreach, not just for COVID-19, but for public safety power shutoffs and fire emergencies.
I am asking this question because these are workers that comes with a visa, and they are not familiar with the area, and maybe they are not on social media. So that's why I was wondering if you are planning to provide some workshops or educate about what is going on or the protocols that are happening here in Mendocino County.
We are working with our agricultural commissioner, as well as Devin Jones from the Farm Bureau, as well as CDFA, which is the California Department of Agriculture, which is putting together a robust response to seasonal agricultural workers that are coming into the community that may not know about the protocols or what's going on. So we are trying to work with our agricultural community, with our seasonal workers, and hopefully address it at the workplace level, but also within the community.
Okay. Bueno, hace 2 semanas hubo una reunión con las diferentes comunidades o agrupaciones latinas aquí, porque se está queriendo armar una mejor estrategia para poder llegar a la comunidad hispana en general. Y en particular para los trabajadores temporales que vienen aquí, se está coordinando con el Departamento de Agricultura del Estado de California qué estrategia ellos están teniendo, y también con el Departamento de Agricultura local, y ver de qué manera podemos nosotros llegar a ellos con todos los recursos y el apoyo que podríamos tener tanto del condado como de diferentes organizaciones latinas que hay aquí en Mendocino.
Okay. Gracias.
Next up, we're going to move over to Adrian with the Mendocino Voice.
Hi, everyone. How you doing, Dr. Doohan?
Thank you. Good.
So I wanted to ask about this Walmart. I wanted to ask for a lot of clarification around the Walmart question. Beginning with a question that sort of popped up in the course of you explaining, speaking with Jackie, which is it the case that these Walmart workers were residents so let me just elaborate a little bit. Were they residents of the county? Do you know how long they were working at Walmart between getting the test and getting a positive diagnosis? Were they still on the job during that period? And given that community spread does now exist in Ukiah, is it possible that retail establishments like this are a place where community spread could be occurring, or are they, Walmart's a very big space with presumably very good HVAC. Is the risk inside a big box store like that actually fairly minimal?
So I don't have the case investigation contact tracing file in front of me, but what I do recall is that we have 3 workers and not all of them live in Mendocino County. Is that correct, Becky? I see you. I'm not sure if I'm recall. We have a lot of data that we run through our heads every day. I'm trying to recall about those particular 3 individuals, if they're Mendocino County residents or not. I cannot recall. I seem to remember one might be a Lake County resident, but regardless. Becky, did you have a?
Sorry, they are all Mendocino County residents.
Okay.
However, they did not come to our attention as staff of Walmart until late yesterday.
Because they didn't identify, people self-identify. When we do a case investigation, we rely on what the people tell us. So we don't have any, that's what we do. We ask them about where they work, what their contacts are, and we rely on that information. So, okay, so we got that information yesterday that 3 different individuals were working at Walmart. But let me just answer this question perhaps in a different way. The purpose of so many of the health officer orders that we have are to protect us in just exactly this situation. What if there are people working at the store where you shop? That's why we have social distancing. That's why we have hygiene orders. That's why we have the businesses having to go through the certification process with their mitigation plans. That's why we have universal masking of the public, as well as requirements for masking in the workplace. All of those protections are there to protect us from getting infected if a worker in a place where we shop has COVID. And in fact, what we're seeing when we do our case investigation contact tracing is we're not seeing evidence that there's widespread outbreaks happening in businesses when a person has a positive case. I mean, look at what happened with the Co-op, which is a much smaller store. I was very concerned about that store because it's a very social place. They have a cafe, people go there to visit, the aisles are narrow. And I was really concerned that there might be a large outbreak, but it turned out that the people that were infected were really workers that probably because of the break room or the workroom where they had their lunch was where they transmitted it to one another. But because they were very safe when they were out working with the public, we're not aware of a single member of the public that got COVID from that outbreak. It was all contained within the employees. And that is a situation that we have seen in other businesses. An outbreak is defined as 3 cases within that business that are epi-linked, meaning you think they got it from each other. So in a big place like Walmart, if those 3 individuals, those employees got COVID from 3 totally separate places, we wouldn't necessarily think about that as an outbreak, but we called it an outbreak because we had 3. We don't know if those 3 employees actually had any close contact with one another, but we decided to respond as if they do. But all of those protections that we use, the facial coverings, the social distancing, those are meant to protect us in case there is a case in a business. And I think they are, especially businesses that have good ventilation and that where people don't need to be crowded. So I hope that answers the question.
I mean, it answers part of it. You spoke earlier today about the difficulties at the state level with the data. And it seems as though communication between counties isn't great either if there are cases where people who work in other counties, and this might actually go the other way, people who live in Mendocino and work in Sonoma are positive, and that communication isn't happening. So what I'm wondering is if this creates potential, if this latency in the communication and the data communication is creating potential for people who are COVID positive and maybe not symptomatic or largely symptomatic to continue working. They tell themselves it's just allergies or something, to continue working in places that are a bit more enclosed than Walmart and maybe don't have as good ventilation as a big box or a grocery store do, which often have really fantastic ventilation systems.
Well, the health officer orders also say that you must stay home when you're sick. So if someone isn't aware that they're sick, then absolutely they could go to work. They should be wearing a facial covering. They should be maintaining 6 feet of distance and maintaining hygiene, which are all protective. We do communicate with our county neighbors whenever there's a concern. There's open communication. You know, Dr. Mace in Sonoma County, Dr. Pace in Lake County, as well as I'm regular communication with other health officers when it's relevant. But this is a pandemic. And in pandemics, at a certain point, it's very difficult to keep a control on communicable diseases in the way that we normally would. That's the nature of a pandemic. So there's increasingly going to be cases where we're not able to control the outbreaks, which is very unfortunate. But to the extent that our orders, all of the orders that I've been talking about for so many months, that we put in really early in our county, so we're quite socialized to understand why it's important to wear a mask and all of these things. This is fundamentally our protection. The other fundamental protection is the blanket isolation and quarantine orders. These orders say that if you've been tested by your clinic, let's say your primary care doctor, and you have a positive test, they hand you the isolation orders of the health officer, and those orders say you need to call your contacts and tell them to quarantine. Those blanket orders provide us with protections on a daily basis because we have such good collaborative relationships with the healthcare partners. So these protections are there to help mitigate the spread. But of course, it's terribly concerning. And what's going on just to the south of us in Sonoma is terribly concerning. And we're in it. We're in the pandemic. There's community spread. We're seeing outbreaks. We're seeing everything that you see in a community when it starts to take off. The nursing homes having outbreaks, you know, the number of cases we have, the number of deaths. So we just have to live our lives as carefully as we can and wear our masks, social distance, and stay home when we're sick.
I always appreciate your candor, Dr. Dewan. I just want to ask one last clarifying question, just to make sure I totally have this right. Given that we avoided the watch list because of this data lapse, and given that the policy going forward will be that being on the watch list doesn't imply certain kinds of mandatory shutdown of schools, does that mean that districts in Mendocino County absolutely won't have to apply for this waiver?
That is correct. I mean, as far as I have information that is correct, which I rely on the state, if we are not on the watch list now, we will not have to have our schools go through the waiver process, is what I've been told. So the schools may open if they can follow the state guidance. There is no waiver process. And also, because we have been closely monitoring our data locally in Mendocino County, and I mean, we are on the watch list in my mind, because we qualify by the data, well over qualify. We have, our daily average right now is 9 cases a day. Over 14 days, that's 126 cases. That's well over the 90 limit, and our doubling time is about 20 days. So because of that, I put the watch list orders in place several weeks ago, ahead of being put on the watch list by the governor, and that put higher risk businesses outside in their operations. Like churches must have outside church service now.
Thank you very much, Dr. Dewan. Thank you, Sarah.
Thank you, Adrian. Moving over to Matt with KeyMed.
Hey, folks. Thanks for having today's press conference. My first question could intersect with CEO Angelo, Becky, or maybe Dr. Duhan as well. So Mendocino County Sheriff Matt Kendall revealed to KMUD this week that there's been a 40% increase in suicides since the beginning of shelter in place, sadly, in Mendocino County. And I'm looking at the Emerald counties, Trinity, Humboldt, Mendocino, sort of as a geographic region, thinking about this idea of diseases of despair, which are 3 behaviorally related medical conditions that are experienced with individuals that feel a sense of bleakness, socially, economically. It's often associated with like Rust Belt, Appalachia communities on the East Coast. Those three behavioral related illnesses include drug overdose, suicide, alcohol liver disease. And it's a really heavy reality that in the middle of this pandemic, there's a social emotional toll that's being put onto our people and our residents in our county. And I'm just wondering if you want to speak to that reality in our county. Are we seeing an increase? What words do you have to say of comfort? Well, in a public health officer's perspective, how do you weigh this reality versus the lethality of a virus? I wanted to give you an opportunity to speak to that.
Thank you, Matt. You know, we're not seeing the worst of this yet. We're still surging up. We're not slowing the spread. We're not flattening the curve. I actually had a hopeful time last week when I thought we were, but then I realized it was a data lag issue. The state has suggested that the surge is going to peak in around Labor Day, so in another month from now. We've been in this state of emergency for many months. Most of the schools in our county are not going to be able to open because they won't be able to comply with the state orders. And we're living in a pandemic. You know, this is very, very difficult. This is extremely unusual circumstances that we're living in, and it's tragic. There are many, many tragedies. What I will say is we're going to get through it. There's going to be a day when the pandemic's behind us. I think it's a lot like living through war. We're in wartime. And there will be a day when we celebrate whatever that is, the vaccine or the treatment that's curative, and we will celebrate together. And we will look back and we will celebrate all of the ways that our community came together. There's so many incredible stories. Sherwood Oaks, with all of the tragedy we had there, is a story of the 3 heroic nurses who worked nonstop in that COVID ward. They worked 12-hour shifts and then they got a day off and came back for 12 hours. Those nurses are heroes. We have many heroes around our county, and we will look back one day, we'll recognize those heroes, and we will recognize how resilient Mendocino County was once again to get through hard times and to pull together and help one another. So I know there's many, many positive stories that we have in this pandemic that we hold in our hearts, that we tell one another. And I think it would be a good idea soon to lift up those stories and share them, because stories like that give us hope. So I'm just today going to focus on those 3 heroic nurses at Sherwood Oaks and thank them for their service. I'm sure they saved lives with their dedication.
So if I can add, so we do have the Mendocino County Warm Line, Matt, that is a telephone-based non-crisis support for emotional support for our Mendocino County residents, especially for those people that are feeling stressed and isolated or overwhelmed. You know, this is a very, very difficult time. And the Mendocino County Warm Line, I'm going to give you that phone number. It's 707-472-2311. And it is staffed by people that are able to engage with different individuals and in both in Spanish and in English, and provide significant support for those individuals that are feeling very, very isolated and overwhelmed. And, you know, we all recognize this is a very, very difficult time, and it has changed so many pieces of our lives. And I really have to say, I really appreciate the behavioral health team and being available and staffing that line for our community.
Thank you for addressing that. I know it's heavy, and I appreciate your recognition of that heroism, Dr. Duhan, and that resource, Becky, that the county is availing. The last question I have has to do with the relationship between testing and isolation quarantine orders. Are those that are in isolation or quarantine given a test at the beginning of their isolation? I'm pretty sure it's with the isolation. That means you have tested for COVID-19, therefore you have to be in isolation for a certain amount of time. Is there like a before and after test that's given to individuals in isolation or quarantine to, in fact, verify that they're free of the virus? I'm just curious, testing and that relationship between isolation and quarantine orders.
Yeah, that's a great question. And actually, the isolation and quarantine orders spell that out if you want to read them. They're lengthy documents, but they're not that lengthy, actually. They're meant to be very helpful. They're on the website. You'll see the orders that are actually handed to people when they have a positive test. Unfortunately, because of the dysfunction in testing in our nation, including in our state, there's such a lag between when results come back for people that it's questionable how useful the test is other than for a public health monitoring purpose. But this is how it works. When someone goes and they're sick and they get a test, they have COVID symptoms, they are, by the blanket isolation and quarantine orders, supposed to be handed by the clinician who ordered the test orders that say you must stay in isolation for 10 days or until the result comes back. So they're ordered into isolation on the day they have their test if they have COVID symptoms. Then when the result comes back, they're either told, oh, you are positive, and hopefully the test comes back before the 10 days is up, but sometimes they don't come back until they finish their isolation. So the isolation is from the day of the test for 10 days forward. So hopefully they get their result back before 10 days are up. They would if they went to the hospital, for example. So they are ordered into isolation before their result is back often. And that's very protective for us because we have such a delay in getting results back. It could be 14 days before the result comes back. And we look back and we often, it occurs on a daily basis, we say, fantastic, that person actually was isolating, even though they didn't have their result back. So that's the case of someone who's sick. When someone is sick and they have a COVID test, there's blanket quarantine orders, and we tell them you need to let all of your close contacts know, people who've been within 6 feet for more than 10 minutes, that they must quarantine. And so that is something we're relying on every individual in our community to tell their close contacts, oh, you need to quarantine, and we're relying on those people to quarantine. Then our team, our case investigator and contact tracers, will reach out to them and make sure they're staying in isolation. To the extent that we can reach their close contacts, we reach out and make sure they stay in quarantine. The quarantine is for 14 days from their date of last contact with the case. And a question came up today from our clinic partners. What happens if we run out of the ability to do testing, which it's actually within our reality? Or what if we know the testing is going to take 14 days and maybe the person refuses a test? Or what happens if someone has COVID symptoms and they don't get a test? Well, we would still ask that clinician put that person into isolation. But if we haven't had a test that we're waiting for them, if we don't have a test, we don't follow them in our CD team. So we follow with our case investigation contact tracing people who've been tested for COVID when we get the positive test result back. So unfortunately, there's a lag. We may not be following that person as isolation in public health because we follow those people that have positive tests.
Thank you, Doctor. Appreciate all you taking time.
Thank you, everyone, for joining us here today. This has been our Friday COVID-19 update. Thank you to our panelists and our media for joining us. If you came in late, we'll be posting a recap of the highlights later this afternoon, or you can watch the replay on YouTube or Facebook. And we'll see you guys again soon. Have a good weekend.